Hello and welcome to the Maddie's Fund Ringworm Apprenticeship Introduction. My name is Laura Mullen. I come from the San Francisco SPCA, and I'm going to be talking a little bit about ringworm and about our program here at the San Francisco SPCA. Dermatophytosis, which is commonly known as ringworm, is a superficial infection of the skin. These fungus invade the skin and inhibit the keratin layer of the skin, and then it causes some ringworm infections. This is very common among shelter settings. There are 3 species of ringworm that are most commonly affected with the shelter cats and dogs. They are Microsporum canis, Microsporum gypsum, and Trichophyton metagrophytes. In 2008, the SFSPCA began to intake ringworm-positive animals from a city shelter. By 2012, our program was going well, and we decided to launch the SPORE Program. SPORE stands for Shelters Preventing Outbreaks of Ringworm Through Education, and it was designed to provide assistance to surrounding municipal shelters, giving them tools to avoid euthanasia as the only option for ringworm-positive animals. The program has gotten much bigger. In 2013, we started off by transferring about 78 animals in for treatment. It doubled by 2014, and 2015 we had our highest year, over 250 animals that graduated our ringworm program and went on to adoptive homes. For our diagnosis here at the shelter, we start off with a full history as much as we can, getting history from our patients or at least from the animals where they came from and who their siblings are. We start also out with a full physical and examination of the patient. We look everywhere, including the ears, face, under the arms, under the tail. It can come in pretty surprising places, aside from the normal around the eyes and nose. To achieve our ringworm diagnosis, we do 3 main steps. We first start with a woods lamp examination, then pull some hairs for a direct examination of those hairs, and then finish off everything with a fungal culture. Starting out with our woods lamp, it is important to woods lamp the animals in the darkest room available. We have found that about 80 to 90% of M. canis infections do fluoresce. Anecdotally, working in the ringworm program for the last few years, I've never really met an M. canis infection that has not fluoresced. If you hone up your skills on your eyes and getting into a dark room and get your skills better, you're able to examine a lot more animals and get a lot more positive fluorescence. The fluorescence is caused by the fungus depositing a metabolite on the hair shaft. And so what's important about this is that the actual things that are glowing is the hair and not the skin itself. The hair does glow a very distinct apple color green, and we use that to kind of determine that that is the right color, because a lot of things will fluoresce upon the animals, but there's that distinct color that you can only see in ringworm patients. And the hairs also will be not stuck together. They will be individually fluorescing. We also then follow up everything with a direct examination of those fluorescing hairs. The hairs could be fluorescing for different reasons, so we want to examine the hair and see if we can see any physiological changes of ringworm infection. This is a great tool that gives you immediate results. It's also known as the sort of snap test for ringworm. What we look at is we look at the hairs and see if they are intact hairs or if they have some fungus on them. When they do have fungus on the hair will be slightly swollen, frayed, and a little bit lighter in color. This is a skill that does take a lot of practice, and so once you get good on it, you can determine a very good next step for your shelter animal, but it does take a lot of time to practice, so this will be a good tool to help learn for an immediate result. When we follow up everything with a culture, there's lots of different schools for culturing. Some people do go to the plucking method, and some people do go to the toothbrush method. We do prefer the toothbrush Mackenzie method as opposed to the plucking method because a lot of your hairs will have already fallen off due to how ringworm grows when you are going towards taking a measure of how the culture is going to be and how to actually get the good representation of the skin with the hair. So with our fungal culture, you always want to start with your cultures at about room temperature. And so you'll be learning how to inoculate the cultures. We use our toothbrush to gather a good sample from the cat. If an animal does have a lesion on it, which most of our animals will, we brush the cat all over the cat, non-lesional, for about 10 to 15 strokes, and then finish with the last 5 strokes on the more apparent lesion that we're suspect. If the animal comes in with another kitten that has a lesion on it, and then this kitten does not have a lesion on it, we will do 25 strokes on the cat with no lesion to give a really good sample size of how the culture is doing and how the infection is on their skin. We store the cultures upside down in a warm, dark location, and we monitor the growth daily to track the different patterns, as each species will grow slightly different. It's important to read and interpret the DTMs during the first week of their growth. Each species has a particular growth pattern, so it's important to monitor it daily. Early growth will not fully confirm the species, but it will let you know that you're dealing with an infectious agent, and it will let you know if that animal needs to come in from foster care or needs to be better isolated within the shelter setting. You can also start to tell the different types of ringworm species that are growing. On this slide, you see a picture of Microsporum canis on day 5. Day 7, you can tell how they're growing a little bit differently. And then at the bottom of the page, you can see the growth of Microsporum gypsum and trichophyton metagrophytes. And they're very physically different upon viewing, so you can have a better plan as to what to do with the animal. Now, for treatment, we do start with topical treatments as well as oral treatments. The topical treatment gold standard is the lime sulfur dip, and that is what we use in the shelter setting. In our foster homes and in public settings, we have started to use the pure oxygen fungal wash. Both of those topical treatments kill the spores on contact and help for environmental containment of spores within the room when you are going through the shelter system. We dilute both solutions at 8 ounces per gallon and apply to the dry coat of the animal. We wet the coat from tip of the nose to tip of the tail and be sure to get a fully contact. Once the animal is fully contacted with the topical application, then we can give them a squeeze dry hug to kind of remove the excess, and we provide heat support. Lime sulfur dip is safe for animals of all ages, even nursing kittens. We just separate the kittens from the mom for about an hour and make sure to keep the kittens and the mom warm throughout treatment. For our environmental cleaning, this is one of the most important steps for ringworm treatment, is keeping the areas clean. Once a week, we clean our shelter wards completely, thoroughly with a deep clean. Every day other than the deep clean, we provide spot cleaning. We will go over a lot of the cleaning processes for cleaning ringworm. The most important part is doing the first hard clean, where you can use any cleaning substance, mainly just elbow grease, getting everything up, then a rinse, and then a disinfectant clean using either a diluted bleach solution or a diluted Excel solution. And then rinse again, and then really that's all you need to do to get ringworm out of the place. Now these are talking about non-porous substances such as kennels at the shelter or that sort of thing. But environmental cleaning is one of the biggest components to ringworm treatment. The SFSPCA ringworm program, like I said, was started and more defined around 2008, 2009 was when we first started really getting a concrete program. We do an intake evaluation of every animal that comes into the shelter, and we wood slamp every kitten, or if the animal is coming from either a known shelter that had a ringworm or from like a hoarding situation or some sort of other situation. So those animals are wood slamped and direct examination if necessary. If the animals do look like they are positive, they are put into our positive center, and they are started with a daily itraconazole of 5 mg per kg for 21 days. Animals that are older than 6 months get 21 days in a row. Animals under 6 months, which is the majority of our population, they get a pulse therapy of a week on, week off, week on, week off, so that they finish their 21 days in 5 weeks. Throughout their whole stay of being in the ringworm program, they receive twice weekly lime sulfur dips on Mondays and Thursdays, and every Monday, every animal is cultured before their dip. We also, every Monday, we deep clean our affected wards and make sure that it is nice and spore-free for the animals to be dipped and then returned to, after their culture, to a nice spore-free environment. Every week we evaluate all of our cultures, and on like the Sunday before our Monday movement, and any animal who hasn't grown anything for that week goes to another room called the first negative room. The first negative room also receives treatment while they are in the first negative room for the next week, and then hopefully after plating again the following week, they hopefully are still negative, and they get to graduate through our program, and that's how they receive the two negative DTMs in a row. Our ringworm foster program we piloted this year, and this is a placement for confirmed ringworm positives into foster homes after the initial 2 to 3 weeks of treatment in the shelter. So these are animals that have undergone maybe 3 to 4 weeks of treatment, and then they just need to finish out their last maybe 4 weeks of treatment out in the foster home. But with the understanding that the last 2 weeks are technically negative weeks, they're really not that infectious when they go to the foster home. This has been really good for the foster parents because they feel like they aren't taking in as infectious of animals, and it's been freeing up our positive wards so that we are able to intake more animals from our community, which has been very invaluable. The SPORE program, like I said, it stands for Shelters Preventing Outbreaks of Ringworm Through Education, was started for our surrounding shelters to give them a little bit more education and knowledge about ringworm. We understand that they do not have the funds or staff to treat ringworm at their own facility, but they can be good at detecting and managing ringworm when it comes in. And so these shelters that partner up with us learn how to woods lamp and detect a ringworm coming into the shelter, and they learn how to isolate and shut down a ward while they're waiting for results of the culture. So these partnering shelters have been able to learn a lot more about ringworm and prevent it from spreading within their shelter. The main purpose of the SPORE program and just getting all this education is really just trying to eliminate the fear of ringworm. Lots of times we start off like this old lady on the left when you say, oh, I work with ringworm, or that sort of, or my foster cats have ringworm, and you get this sort of disgusted face. And that's the sort of face that we need to get rid of, because it's nothing that needs to die for. You can help ringworm, you can cure it, just takes a little time, takes a little effort. But we feel that through a lot of talking, through education and discussion, we can change the attitude of ringworm from the scary old lady with the disgusted face on the left to the lady on the right that wants to kind of bring it on and treat it. So it is my hope that we are able to change this attitude of ringworm through a lot of these educational programs. I would like to thank a lot of the professors and researchers before that took a lot of time and effort into letting us know that we do not have to euthanize for ringworm, that there are a lot of ways that you can help avoid the spread of ringworm within the shelter. And I would also like to thank the Maddie's Fund for helping me with this opportunity to be able to get people in from across the country for this apprenticeship so that we can go ahead and teach about ringworm and it doesn't have to be as scary as it once was. Thank you.